Well, good afternoon, everyone. Sorry for that. We had a minor technical delay, so sorry to start a little bit late on you, but we're here now. My name is Sean Egan. I'm the Director of COVID Workplace Safety and a Deputy Director in Michigan's Department of Labor and Economic Opportunity. We have several presenters today. We really want to focus in on tools and resources available to you as we're all continuing to battle COVID in our communities. I'm going to try to catch us up a little bit, so I will jump right in quickly, but we have several speakers today that are going to share some of the tools and resources that you can use as we're trying to help get us through this COVID crisis and just kind of in some ways limp along until we can get to the finish line. We know it's been a challenge. We're talking to businesses across the state all the time, associations. Many of you, you've been very helpful. We're listening, we're hearing you. And while the news focuses a lot on enforcement things that are happening, there are a lot of other resources available to you. One of those from the Department of Labor that we've created with MIOSHA is called the Ambassador Program. This is a proactive consultation program available to you. It's free. We have consultants that will just pop in to your place of business. If you have time, they'll spend about 20 minutes with you and run through a checklist of items that you might need to fix up or take care of. This is not an enforcement action. These folks are just consultants there to help you. And we have what we call the Tier 2 of the Ambassador Program, which is a longer consult where they'll spend a couple, 3 hours with you, run through a longer checklist, identify things that you can improve on. And if you do and pass that assessment, you'll get this window decal that you can hang at your place of business. Our goal there was to try to make sure that you had something that showed that you participated, as well as you could show to your customers that you are taking the steps necessary to try to help us contain COVID in our communities and keep your workplaces safe from COVID. With that in mind, that's a brief description to make sure we try to stay on time. I'm going to turn it over to Amanda Bright McClanahan, who is with the Michigan Economic Development Corporation. Amanda?
Good afternoon. Thank you, Sean. I believe, there we go. First of all, I want to thank everyone for the opportunity to come and speak to you today. My name is Amanda Bright McClanahan. I am the Chief Operating Officer for the Michigan Economic Development Corporation. Over the last several months, the MEDC has been working very hard to try and meet all of the needs of business owners around the state, including businesses like yours that are so critical to making Michigan the attractive place to live, work, play, and visit that we need to stay strong. We will continue to be available and work tirelessly through the rest of the pandemic to meet your needs as best as we can. But to just give you a sense of where we are, we have launched to date 21 response programs and have supported over 18,500 businesses, approximately 147,000 jobs retained, and have helped provide PPE in terms of production with over 2.5 million pieces produced. We've provided assistance to every county, and we haven't stopped yet. We will be moving in the next week. You will be seeing 2 additional programs being launched, including the Michigan Small Business Survival Grant Program that was recently approved by the legislature and signed by Governor Whitmer to provide almost $60 million in assistance to small businesses that have been directly impacted by all of the necessary public health actions that have been taking place. We have worked extraordinarily hard to also set up some additional resources in the way of providing technical assistance, providing planning and transition support, and being able to specifically partner around capital access and additional needs that you may have above and beyond traditional grant programs. I would really like to draw your attention to michiganbusiness.org/COVID-19 response, where you will find a number of resources. not only ours, but at the local level as well, in addition to links to federal resources that are becoming available. We have worked very hard to provide access to specific types of training in partnership with the small business development centers around the state, around cash flow management, around issues of reopening, around issues of trying to diversify different lines of business, and our efforts to provide you every tool that we can to help during this time. We do have ongoing small business relief programs, again, like those to be launched in the next several weeks. And in addition to that, we do have ongoing partnerships with groups around the state that are continuing to provide local grant relief dollars, including Small Business Association of Michigan, the Michigan Retailers Association, the Michigan Downtown Association, and of course the Michigan Restaurant and Lodging Association, in addition to our partnership with the SBDC. I would also like to talk a little bit about the ongoing Support Local campaign. I hope that you've all been able to see it on social media. It is a program where we are doing our level best to use our brand and the associated Pure Michigan family to put as much support behind supporting local businesses as we possibly can, and asking folks to go out and to do those purchases and to take a moment and maybe feed their family through carryout instead of cooking at home. You will see those ads continuing to run and through social media and other supports over the next several weeks as well. We have been extraordinarily excited to get Pure Michigan back on the airwaves. That did happen on December 21st. If you have an opportunity to take a look at it, it is a campaign that is directly supporting the tourism-facing industries, including restaurants around the state, and it is calling attention to the fact that Michigan can be a safe place to go out and enjoy some of our winter activities, and draws attention to additional resources for folks looking to do that. Finally, I would be remiss if I didn't mention, if you are having issues securing PPE for yourselves or your employees, please visit our PMBC COVID-19 platform. It can be found at the website that you see on your page here. That platform will allow you to put in your information, and we will work to match you directly with someone who is supplying those needed supplies, a Michigan business like yourself, and work to ensure that you can get those supplies as quickly as you need them. Again, a wide variety of programs that are available, and I believe, Sean, I think it's included somewhere in the materials, a link to how you can sign up for our newsletter to stay up to date on services and resources to help your business. If not, I'll provide it again. The same website, michiganbusiness.org/COVID-19 or COVID-19 resources. Thank you.
Thanks, Amanda. Now over to John Schmidt with the Small Business Development Center.
Good afternoon, everybody. And first of all, I'm a senior business consultant with the Michigan Small Business Development Center. And SBDCs are located throughout the state, and we've been working with small businesses throughout the last 30 years or so, providing free consulting services for businesses. For myself, I'm a former restaurant owner. I very much understand the situation that's going on, and we all feel our pain on this. Within the Small Business Development Center, many of us are former business owners, so we kind of give you a little bit of a ground level. We're funded through the Small Business Administration and also through the Michigan Economic Development Corporation. As part of our mission, one of the things that since COVID has hit, we have received some funding through the CARES Act to provide free services, free programs. For restaurants specifically, we offer a free subscription to restaurantowner.com. Restaurant Owner is it's a great website in that, particularly for restaurants that are currently in businesses right now, provides best practices, what other restaurants throughout the country are doing to try to combat the COVID, be able to keep the doors open in one form or another. We also, because we're funded through the SBA, receive regular updates and meetings with the Small Business Administration. And with the recent CARES Act that was passed, of course, the new PPP, Payroll Protection Program, and also the Economic Injury Disaster Loans, which have been refunded. We're learning the details on the PPP right now. It has been expanded. It's a little bit more liberal. I think one of the most important parts that we've seen with the new PPP is that while you still have to maintain your 60% labor costs, the other expenses are also going to include your supplier costs. So anybody in the restaurant business, this would help you for if you had to close and your inventory was no longer any good, you could now claim that as an expense and get that forgiven. The full details haven't been fully released yet by the Small Business Administration, but as we find this out, we try to work with our clients. On the slide here, you see the contact telephone number 833-522-0025 and sbdcmichigan.org. If you go to this site, you can sign up for consulting. Once again, our services are at no charge to you. And because we are located throughout the state, our consultants in each of the different regions, they know the local programs, whether it's state, county, township, that are being offered to help food service businesses within this industry. The other thing I would encourage you to do, because this has hit not just restaurants, but everybody involved in the food supply business, reach out to your food suppliers, where there's Cisco, Reinhardt, GFS, US Foods. They're developing programs themselves to try to help you be able to sell food, whether it's through carry-out, to-go orders or that. And they also know their best practices. So with that, we're all trying to keep it together. We're all trying to be able to serve great food and be able to keep the doors open one form or another. If there's any way we can help you, please reach out to let us know how we can help you. And with that, I'll hand it over back to you, Sean.
Thanks, John. I really appreciate that information. And we'll jump over to Jeff with the Department of Treasury.
Good afternoon. I just wanted to provide a quick update on taxes. In particular, the Michigan Department of Treasury delayed the payment date for certain taxpayers for sales use and withholding taxes from December 20th to January 20th, 2021. To qualify for this delay, you had to meet two criteria. So first, you had to be a non-accelerated filer. So that should be most of the businesses on this presentation. Generally, you're a non-accelerated filer on the sales tax side if your taxable sales last year were less than $12 million. And on the withholding side, you're a non-accelerated filer if your taxable wages paid out last year were less than $11 million. And the second thing was you just needed to be a business that was impacted by the Michigan Department of Health and Human Services emergency order issued on November 15th. These businesses included food service establishments with indoor dining, recreational facilities and places of public amusement, such as amusement parks, bowling alleys, roller rinks, and so forth, entertainment venues such as banquet halls, cinemas, conference centers, etc. So for more information on the types of businesses covered, you can see the MDHHS order. And if you have questions on this delay or any other questions pertaining to your taxes, you can call the number listed on the slide, 517-636-6925.
And that was quick. Thanks, Jeff. Appreciate that. We have a few folks from DHHS now with a few of the things they're doing. We have Josh Rivera, Don Sweeney, and Sarah Esty.
Hi, everybody. If we can go to the next slide. This is Josh Rivera. I'm the Policy Director for the Economic Stability Administration. I'm here to talk about a new program that's been rolled out by MDHHS called the Restaurant Meals Program. So for those of you who've heard about this program, I wanted to give a quick synopsis of what it's about and how you could be a part of it. So the Restaurant Meals Program allows our elderly, disabled, and homeless individuals who are receiving food assistance benefits to use their electronic benefit transfer card to purchase hot prepared meals for participating restaurants and grocery stores. So typically, if you receive food assistance, you are not allowed to use your food assistance benefits towards food at restaurants for hot prepared meals, but this new program allows an eligible group to be able to do so. Next slide, please. The benefits of this program are threefold. The first is that we believe, as is seen in other states, that there could be increased revenue. There are many participants who are eligible for this program who receive food assistance. There's about 184,000 elderly participants alone across Michigan, but it's also about serving your community. The main goal of this program is to help individuals who struggle to prepare their own meals or lack kitchen access at home. And finally, it's about tackling food insecurity. We know across the state that nearly 13% of households in Michigan are food insecure, meaning that they face difficulty acquiring food due to insufficient resources. And together, a partnership between MDHHS and participating restaurants can ensure that those populations and those residents across the state can get the food they need in a dignified setting with the safety and security of getting it from their local restaurant. Next slide, please. So who's eligible for the program on the restaurant side? Well, a restaurant's eligible if they're defined as a private for-profit establishment where meals are sold and served to customers, including in-store delis and food trucks. And there's a couple participation requirements. So you have to have more than 50% of total sales in food. You must be fully accessible to the disabled. You have to have sit-down seating available, unless prohibited by a public health order that would only allow delivery or takeout. You cannot be a bar or tavern, so bar and taverns are not eligible. You must have a valid food service license, and then as part of the process, you have to be approved by MDHHS and the Food and Nutrition Service. Next slide, please. Once you've deemed that you're eligible, there are a couple participation requirements for staying in the program. As stated earlier, you have to have sit-down seating available. You must not charge sales tax to participants in the program. You will display the RMP logo at your restaurant. You'll sign an agreement with both MDHHS and the Food and Nutrition Service to, among other things, offer low-cost meals. And then you have to have a point-of-sale device for use so that our recipients can actually buy food once they get to your restaurant. Next slide, please. The approval process is fairly simple, and it's 5 steps. So the first is that you'll end up signing a memorandum of understanding with MDHHS. You'll complete an application for certification from the Food and Nutrition Service. That form is titled FNS 2522. And then you'll send that to us at mdhhs-restaurantmealprogram@michigan.gov. Once we receive both documents, we will query that for FNS approval. And then the 4th step is that you have to make sure that you are able to integrate EBT into your commercial point of sale equipment, and then ultimately begin serving RMP participants. We are happy to go through this process with you. If you have any questions, feel free to email us and jot this down. It's mdhhs-restaurantmealsprogram@michigan.gov. Next slide, please. And with that, we'll turn it over to our next speaker. I'm happy to take any questions from folks afterward. Thank you.
All right. Hi, everyone. This is Sarah Essie. If you can go to the next slide. I am here to talk a little bit about our epidemic orders. So we've been getting a lot of questions about how we make decisions and what we'll be looking for as we reconsider the current order, which is set to expire a week from Friday. So what you can see here are our 3 key metrics, which are the share of hospital beds with COVID-19 patients, the COVID-19 case rate, so number of cases per million residents, and the % positivity. We've been using these since our pause to help decide whether we're ready to reopen, and these remain the key metrics that we're looking at. Next slide. So for those who'd like a status update on where we're at, you can see here that we have seen improvements across all 3 of these metrics since our pause went into effect in mid-November. So we've seen about a 4-week decline in positivity, over a month decline in cases per million, and a decline for about a month now on hospitalization, and that is often the last metric to move. So all of this is very encouraging and shows the pause has worked, and we have brought under control what was otherwise exploding COVID growth. Next slide. Unfortunately, some of our most recent data, just the last few days, has us a little bit worried. So you can see here that the R0, so that's how many people each person with COVID infects, had for a while been under 1, which means COVID is declining in the state, and now is right around 1 and potentially rising. So we'll be watching that closely. We also have seen new cases starting to plateau rather than continuing their decline. So again, we will be watching that very closely over the coming days and hope to see that start falling again. Next slide. The other thing that we are watching closely as we look at orders going into next week is the new UK variant that some of you may have heard about. So this is a new strain of COVID that appears to be significantly more transmissible than the strain that we have had to date in Michigan. There have been cases found with this type of COVID in the US. So far, we have not picked it up in Michigan, but we really don't know if it's here, and it might be a while before we pick it up. If and when it does come within our borders, I think we're all very concerned that it could cause a significant increase in cases. So we will be continuing to monitor this closely and consider the implications for our orders. Next slide. So for any who might want to keep up with our latest orders or know where to find materials, this is the link, and this takes you to our main Epidemic Orders page. And that is where we post new orders when they come out. It is where our FAQs and our infographics are posted. If we have amendments or changes to the orders, all of them can be found there. So this is a great resource for you all to bookmark, and you can check it out next week for the update for the current order. Next slide. So we also have been getting a lot of questions about vaccines. So as you can see here, these are the CDC prioritization categories. We are currently in phase 1A, so we are vaccinating people in long-term care facilities and healthcare workers who are on the front lines, like hospital workers. Soon we will be moving into phase 1B, which is our oldest seniors and frontline essential workers who weren't covered under the healthcare workers. After that, we will move to 1C, and that is where restaurant workers are covered, and then the general public will be able to be vaccinated in phase 2. And the link at the bottom, michigan.gov/COVID vaccine, is where all of our latest information on vaccinations is housed. We frequently have updates to our vaccine plans. There unfortunately is a lot of uncertainty about the supply of vaccines that we'll receive from the federal government and the vaccine manufacturers. And so we are getting vaccines out as quickly as possible as we receive them. And so when we move from one phase to the next is really dependent on how much vaccine we get. And so the COVID vaccine website is a great place to go for the latest on what phase we're in and maybe when we're anticipating being able to go on to the next phase. And that's it for me.
Sean, I believe you're on mute.
I had to do it. So I was just saying that we covered a lot of information very quickly. Don't worry, this is being recorded and we're going to share it out later this week so you can review this. We have several questions that we're going to cover from industry. Over the next several minutes, we know this will not get to everybody's questions. We're going to share an email address at the end of the presentation that you can send emails into. We'll get those around to the right departments to really help you find the answers that you need as we continue to move forward in our fight against COVID. I'll kick off the questions that we're going to cover, and the first one is for DHHS. Sarah, I think you touched on this briefly in the presentation, but the question we received was, what metrics are being used to decide when it's safe to open restaurants? Is there anything else you'd like to elaborate on?
I mean, I think I covered it before. So the three key metrics are percent positivity, cases per million, and share of hospital beds. I know that there have in the past been interest in folks saying, what are the specific numbers that we have to hit and then we can reopen. And unfortunately, we just can't give specific number targets, partly because the numbers interact with each other. So for example, if you're seeing low case rates, few cases per million, that could be because not a lot of people are getting tested, or it could be because the number of infections has in fact gone down. So you need to look at all the numbers together. And also the numbers mean different things at different times. So for example, as vaccination becomes more widespread, the likelihood of a quick acceleration in the number of cases goes down. And so a high case rate might mean something different now than it means in the future. So we just have to keep monitoring it and look primarily at the trends and the numbers together as opposed to specific targets.
Okay, thank you, Sarah. There's a lot of questions here for DHHS, so keep your mic on. We've heard from restaurants that they need up to 2 weeks, maybe some lead time to plan for a reopening to get the supply chain going, get things that they need. So the question is, if restaurants reopen on the 15th, will that take immediate effect or would there be time to plan ahead?
So unfortunately, we try to give a couple days notice before orders take effect. So the new order that will come out next week to replace the order that expires on the 15th, we'll try to get that out midweek. But we typically are not able to put orders out a week or two in advance because we're using the very latest data to make our decisions. And so if we made decisions that don't take effect for 2 weeks, the numbers would basically make the orders obsolete by the time they went into effect. And so we realize that's really frustrating for folks trying to make advanced plans. And I guess the best that I can say is if we did try to put out orders far in advance, it would only further slow down our reopening because we'd have to wait longer before we could be really confident that the numbers weren't going to move for a couple weeks. So I know that's tough, but we're doing the best we can to use the most, newest data to make the right decisions.
Okay, another one here for DHHS. When will restaurant workers be able to get the vaccine and what will the process be?
So food service workers are in category 1C, and right now we're in category 1A. And I think hopefully quite soon we will be moving to 1B. We don't have to finish one group before we start the next. So, we're not going to wait till every single person over 75 is vaccinated before we start with the next group. But I do think there will be a number of weeks while we're making our way through 1B before we move on to 1C. And a lot more information will come out with details about how folks will get vaccinated as it gets closer. And a lot of these things are being figured out in real time, given this is the largest vaccination campaign in American history. So we'll just have to get you more information down the line.
Perfect, thank you. I have one for Treasury. Do banquet halls count as entertainment venues for the SUW payment delay?
Sure, so the short answer to that question is yes. The slightly longer answer is that if you're somebody who was closed as a result of that order that was issued, the pandemic order, then you likely qualify. You can look on the order to Treasury's webpage, michigan.gov/Treasury, and then click on the COVID link. You could find additional information. But as a general rule, if you're in a situation where you were closed because of that pandemic order and you're a non-accelerated filer, you do qualify for the delay.
Okay. Next question is for me. Is any restaurant eligible for the MIOSHA Ambassador Program? And the answer is yes. We're focused in on small businesses. So if you're a really large restaurant, perhaps not, but we're focused in on those businesses that are generally open to the public, which would include restaurant and bars. We know right now you're doing curbside, so perhaps a great opportunity to take advantage of that Tier 2 consultation where you're going to need to spend a little bit more time with the ambassador to get that wonderful window cling. But yes, we're out there. You can find those resources on our webpage at michigan.gov/COVID workplace safety. There's a link to the ambassador program as well as a link to request that consultation. And you will see those ambassadors just pop in those type of establishments. And I would encourage you to take advantage of that resource to really help you understand all the things that you need to be implementing. Next question is for both DHHS and I. Who oversees enforcement of the various orders and rules, and do I need to follow all of them? So if you've joined me for any of our webinars we've done on workplace safety, this question comes up quite often, and the answer is yes. You have MIOSHA emergency rules, which govern your employee-employer relationship and the things that you need to do to keep your employees safe, and the DHHS epidemic orders. Now, my advice that I normally give is the emergency rules from MIOSHA are rules. They're going to be relatively static. They have some specifics in there. They have a plan, and we have a template on that same website for plans. Get that lined up, get it set to go, and then pay attention to DHHS and their epidemic orders, and those what I call is more variable. I see Sarah looking right at me in the camera that you can't all see. I call those more variable that you're going to need to layer into those plans as things change with COVID. Sarah, is there anything you'd like to add there?
I mean, I think you covered it. Businesses do need to comply with all the orders and rules that apply to their type of establishment. I'll also add that there may be local health department orders, not just state orders. So we've seen that over the course of the pandemic, sometimes local conditions might be quite different than other parts of the state. So you do need to follow those as well. And then, it's not just Leo and DHHS that are enforcing the orders as well. So some of you may have had interactions with Laura, MDAR, liquor control, but all of the different state departments have different roles to play in the orders. And so we urge everyone to follow all of the orders and to work with all of the different regulatory departments as questions or issues arise.
Thank you. Next question is for the MEDC. Two-parter. When will small business relief that the governor signed into law at the end of the year be available? And are there any details on eligibility and the application process?
Thanks, Sean. That's a great question. Yes, the Michigan Small Business Survival Grant Program is currently under development. On January 14th, the program will be taken to the Michigan Strategic Fund Board as required by statute to be formally approved. We will then be posting all of the eligibility criteria and the process for that program after that board approval. The website that I said earlier, michiganbusiness.org/COVID-19, will have not only that application information and the program requirements, but will also be the place where you may go to apply for funding. There will be a link there that will become active. We don't have a formal date yet, but we will share that as soon as possible. And we'll also share that through social media and other channels to make sure that you all have that information. Thank you.
Thank you, Amanda. I have two more questions. They're both going to be for DHHS. And the first one is, can a restaurant apply for a refunded licensing fee from their local health department? And if so, how?
So that would really be an issue for your local health department. So I am not sure whether there is a uniform process they've set up and if that's available, but you should reach out to your local health folks to ask about that.
Okay. And then the last question we have for now is why are casinos open but not restaurants?
So the focus is on areas where people have their masks off. And we know that that is just really high risk for COVID. And there's at some level really no amount of mitigation measures that can make having your mask off inside safe. And so that's why venues or activities that require people to take their masks off aren't permitted right now. So it's why casinos and bowling and arcades and other venues like that are open, but only without concessions, because people can keep their masks on at all times, whereas there's no way to eat at a restaurant and keep your mask on, unfortunately.
Well, thank you for that, Sarah, and thanks everybody for participating today. That's the end of our presentations as well as our questions. But as I mentioned, we know that that is not all of the questions that you all have. If you want to send those in to leo-comms@michigan.gov, we'll do our best to get those around to the right departments and agencies to make sure that we're getting you information as quickly as we can with answers that you need as we continue to battle COVID together. We have the light at the end of the tunnel with the vaccine, but as we know, it's going to take some time. So we have work to do in the meantime to make sure that we're protecting our workplaces, protecting our employees, and protecting our communities. And we know it's hard. We talk with, like I mentioned, a lot of people across the state every single day. Scott Ellis at the MLBA calls me nonstop to let me know what's happening and look for ways that we can help find resources and tools to keep it going as long as we need to get through this COVID crisis. And everybody's working hard. We're here for you, and we're happy to do these types of presentations and share these resources as you need them so that you can be fully aware of what we're trying to do. And I really appreciate you taking the time to join us today to listen. As I mentioned, this will be recorded, is being recorded, and will be shared out later in the week. So we'll make sure we get it out to you, and feel free to send in questions as needed.